One of the things I love the most about research is being able to work with people from different parts of the world and gaining insights from their cultural perspective. I think that's one of the things that make a research great. And I've been really fortunate to be working with you guys from the United Kingdom and also in Brazil. Actually, in Brazil, we also have a public health system that we call SUS. And SUS was actually inspired by the NHS, right? Because you guys have the biggest public health system in the world. So there are some similarities in the way that the health system is structured. For example, we also have GP surgeries and where patients are seeing, and we also have many mental health demands that happen in GP surgeries, and we also reference the patients. The structure of the system is very similar. But I think that what's really different is the demographic characteristics of each population. So, for example, here in Brazil, the inequality gap is bigger than in England. So obviously there's also inequality in England, but when we look at the income gap from the most vulnerable groups in Brazil, it's a larger gap. So when we go to work in vulnerable communities here in Rio, for example, we really see the difference in patients' demands and patients' needs. So for example, I work right now, I'm doing my elective in a GP surgery that it's located in a very vulnerable community here. Mm-hmm. And we see lots of mental health demands related to violence. And also when I say violence, I mean urban violence. It's different in this way, in this sense.